Hello everyone, today we'll be talking about history and examination of the psychiatric patient. So this video is divided into two. The first part will talk about the history and the second part about the mental state examination. So let's talk about the history. The psychiatric history follows a similar format as the history for other types of patients. It should include the following: identifying data, which we commonly call demographic data, which includes the patient's name, gender, age, race, marital status, place and type of residence, occupation. And we go to the chief complaint, or what we commonly call presenting complaint, and here you need to make sure you use the patient's own words. If called as a consultant, you need to list the reason for the consult. Then you need to mention the sources of information. Is it collateral? Is it from the patient? Then is it reliable or is it not reliable if it's from the patient? Then we go to history of presenting illness. So this consists of the 4Ps. So what does that mean? The patient's psychosocial and environmental conditions predisposing to, precipitating, perpetuating, and protecting against the current episode. So what you need to take note of, like maybe for example, our diagnosis is depression, major depressive disorder is what you're suspecting. So you need to know what was predisposing to that, what precipitated it, what perpetuated it, and what's protecting against the current episode. The patient support system, whom the patient lives with, distance and level of contact with friends and relatives. Talk about neurovegetative symptoms such as the quality of sleep, appetite, energy, psychomotor retardation or activation, concentration. You need to always make sure you ask about suicidal ideation and homicidal ideation. Then you need to also talk about how work and relationship have been affected. For most diagnoses in the DSM-5, there is a criteria that specifies that symptoms must cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. For example, one example of this is mania. Though you know how we can actually use this for differentiating, because hypomania, when you talk about it, it does not cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. However, mania does, so that's one of the differentiating factors. So it's very important that you take note of this. Talk about psychotic symptoms such as auditory and visual hallucinations to establish a baseline of mental health. Patient's level of functioning when well, goals in outpatient setting. Then you go to the past psychiatric history, so all that was about history of presenting illness. So past psychiatric history include as applicable. So you need to include the history of suicide attempts, history of self-harm, cutting, burning oneself, information about previous episodes, other psychiatric disorders in remission, medication trials, past psychiatric hospitalizations, and current psychiatrist. I talk about substance history, history of intravenous drug use, participation in outpatient or inpatient drug rehab programs, medical history. We need to ask specifically about head trauma, seizures, pregnancy status. Then family psychiatric and medical history includes suicides and treatment response, as patient may respond similarly. We need to ask them, do they have a history of mental illness? Then if they're like yes, then you ask them, did they get treated? Yeah. Then did it work? So if it did work, so you know that most likely even our patient is likely to respond to the therapy. Developmental history. So achieve developmental milestones on time, friends in school, performance academically. Go to the social history, which includes income source, employment, education, place of residence, who they live with, number of children, support system, religious affiliation and beliefs, legal history, amount of exercise, history of trauma or abuse. So that's all about the history. Stay tuned for the second part, which is going to be the mental state examination. Thank you.